The first step in placing an IV catheter in the cephalic vein is to clip the area with the number 40 blade and clean the area antiseptically. Here I will be using Chlorhex scrub and sodium chloride. The materials you need to put in an IV catheter are clipper blades with the number 40, 1-inch tape, white tape. At our clinic, we like to use a 2x2 and vet wrap to secure once we have taped it in, heparin flush, and the correct size catheter. Here I will be using a number 22 gauge catheter. Place the thumb of your non-dominant hand on the vein below your intended point of entry. Pull the vein down firmly to create traction. This will ensure that the vein will not move when you insert the needle, and it also raises to the surface. You want to enter the skin at about a 45-degree angle. Once you see flush, which is the blood coming into the cap, you know you are in the vein. You then proceed. Once you see flush, advance the catheter until the hub reaches the pet's skin. Next, I put the cap back on the end of the catheter and use half-inch tape to secure the catheter in. I usually go one to two times around the leg using the half-inch tape. Next, I'll use 1-inch tape and go around the leg once to help secure the catheter before placing the injection port. You can also use a T-port if the patient is going to be in fluids for a long amount of time. Once the cap is secure, I then go around the leg 1 to 2 more times with the 1-inch tape to make sure that the catheter is properly secured. Once the catheter is securely taped in, I will then get hep flush to check to make sure that after taping, the catheter is actually still in the vein. Cephalic venipuncture. Once the assistant has the patient properly restrained, they may then form a tourniquet with their thumb or forefinger, which is wrapped around the forearm at the level of the elbow. Pressure at this point occludes the cephalic vein. The skin is then rotated to roll the vein to the top or interior of the forearm. The venipuncture grasps the leg with one hand at the level of the metacarpus and further extends the leg. The needle is directed as much as possible along the longitudinal axis of the vein. The needle is inserted through the skin with the bevel facing up. The skin punctures the painful part, and animals will most often respond to this. Once the animal has settled down, the needle can be directed into the vein. If blood does not spontaneously flow into the hub of the needle, gently aspirate to determine if the needle is or is not into the vein. If not, the needle should be advanced a bit further and the process repeated. Once the blood sample is taken, The needle is withdrawn from the vein and digital pressure is applied over the venipuncture site for at least 30 seconds. The site should be monitored for bleeding or hematoma formation for additional several minutes. Giving an IM or intramuscular injection. The intramuscular or IM route is appropriate for the injections of small amounts of medication. Drugs are most often administered in the semimembranosus or semitendinosus muscles of the rear leg. The needle should enter the lateral aspect of the muscle and be directed caudally to prevent penetration of the sciatic nerve. Contact of the needle with the sciatic nerve may cause pain and lameness. Once you've figured your injection location, you should pull back to make sure you haven't hit any blood vessels. Then you can proceed with injecting the medication. When giving this injection, I should have not put in the cap in my mouth or recapped the needle and put it in a disposable container. And that concludes my Vet 121 skills tape. Thanks for listening.